Heart attack symptoms aren't always obvious. Silent heart attacks can strike without you even knowing they're happening. Here to talk more about this as we wrap up Heart Month is Dr. Omar Awar, a cardiologist affiliated with Memorial Hermann Memorial City Medical Center. Welcome to Houston's Morning Show.
Thank you for having me.
It sounds kind of overwhelming to have a silent heart attack. Would you even feel any symptoms? What's going on there?
Well, when we typically think about somebody having a heart attack, we think about somebody clutching their chest and saying they have an elephant sitting on their chest. But many people who have a heart attack will have what we call atypical symptoms. And that might be pain in a different area other than the chest, such as the jaw, arm, or back, or there might be no pain at all. It actually might just be shortness of breath, which you could mistake for a respiratory or viral infection. It might be nausea or a burning sensation in the pit of your stomach, which could be easily confused for indigestion, or it could just be simply fatigue. And unfortunately, these atypical heart attacks are just as bit as dangerous as a heart attack associated with chest pain, and have the same risk of death and other complications.
So how does it end up being detected usually? Is it after the fact because those symptoms go silent, or because they mimic so many other problems?
Right, that's exactly right. So oftentimes it's after the fact or after a significant amount of damage has already been done. So if you feel acutely ill with one of these symptoms, it's important to seek attention. Don't wait on it. Don't let the symptoms drag out. And if you have more gradual onset of symptoms, such as you used to be able to walk up a flight of stairs and you can no longer do so without getting short of breath, let your doctor know. Don't just assume that you're out of shape, because by assuming and drawing your own conclusions, you might be letting valuable time tick away where you could be getting your heart treated.
What causes a silent heart attack in the first place? So
it's the same things that cause a regular heart attack, and there are some established risk factors: high pressure, high cholesterol, diabetes, types of things. And so it's important to check in with your doctor for regular checkups so you know whether you're at risk. And heart disease afflicts people of all backgrounds, all body types, all fitness levels. Nobody is immune to heart disease, so it's important to get checkups regularly.
Do you see these type of heart attacks that we're talking about more often in women? Because it does seem like so many times that the man is the one who's grasping his chest versus the woman.
Right, yes, we do. So women more likely or more often will have atypical symptoms. And when they do have symptoms, they're more likely to attribute it to something else: stress, anxiety, panic attacks. And so women on average wait longer to seek medical care. And unfortunately, despite all the advances that we have, women continue to do worse than men after a heart attack for many of these reasons.
And so what do you suggest to women? Is there a certain time when you should get a full cardiac workup before you even have symptoms, or is this something you just need to watch those numbers you talked about, like your blood pressure and your cholesterol levels?
Right. It's hard to kind of come up with a general plan for the whole population. It's really on an individual level, so it's important to establish